everyone, I'm Meg from the Gwinnett County Public Library, and today we're going to be talking about COVID-19 vaccination, why people are interested in it, why they might be afraid of it, and whether they should get it. And I have a panel of experts here with me today. I have the HOSA students. HOSA stands for Health Occupation Student Association from McClure Health Sciences High School in Duluth. And they're going to introduce themselves right now.
Hello, my name is Adna and I go to McClure Health Science High School, and yes, I am a ninth grader.
Hi y'all, I'm Jalen. I'm a senior at McClure Health Science High School, and I basically just wanted to inform people in our community about like the risk of COVID and also like the myths and stuff about COVID that people have.
Hello, my name is Stefania and I am currently a sophomore at McClure Health Science High School.
Hello, my name is Natalia. I'm a senior at McClure Health Science High School, and I'm currently pursuing a pathway course into health science.
Good afternoon, my name is Khalif and I'm a junior at McClure Health Science High School, interested in medicine after high school.
My name is Krastard and I'm a ninth grader.
All right, thanks everybody. So let's jump right in with some questions that we've gathered. We gathered these from people we work with, from our family, from stuff we've seen in social media. And then we just rounded up all these questions, so we're going to get started. So who wants to talk about what the health concerns are around the COVID-19 vaccines?
So CDC and FDA scientists have evaluated reports from people who experienced a type of severe allergic reaction, anaphylaxis after getting a COVID-19 vaccine. Anaphylaxis after a COVID-19 vaccination is rare and occurred in approximately 2 to 5 people per million vaccinated in the United States based on events reported to VAERS. This kind of allergic reaction almost always occurs within 30 minutes after vaccination. Fortunately, vaccination providers have medicines available to effectively and immediately treat patients who experience anaphylaxis following vaccination.
I heard that if I get the COVID-19 vaccine, it's going to give me COVID-19. Is that true?
No, none of the authorized and recommended COVID-19 vaccines or COVID-19 vaccines currently in development in the United States contain an altered and weakened version of the live virus that causes COVID-19. This means that a COVID-19 vaccine cannot make you sick with COVID-19. There are several different types of vaccines in development. All of them teach our immune systems how to recognize and fight the virus that causes COVID-19. Sometimes this process can cause symptoms such as fever. These symptoms, however, are normal and are a sign that the body is building protection against the virus that causes COVID-19.
What if I already had COVID and I got better? Do I still need to go and get the vaccine?
Yes, you should be vaccinated regardless of whether you already had COVID-19. That's because experts do not yet know how long you're protected from getting sick again after recovering from COVID-19. Even if you have already recovered from COVID-19, it is possible, although rare, that you could be infected with the virus that causes COVID-19 again.
How can I get signed up to get a vaccine?
Every state it differs. May vaccinate older people first, and the goal is for everyone to be able to easily get a COVID-19 vaccine as soon as the large quantities are available. But as supply increases, more groups will be able to receive the vaccine.
I heard that people of color are at an increased risk of being affected by COVID-19. Why is that?
People in the BIPOC communities are at a higher risk of contracting COVID for a number of reasons. The most apparent is underlying health conditions. People who are Black, Indigenous, or people of color are 1.5 to 2 times more likely than white people to have a major chronic health condition like diabetes, lung disease, and heart conditions. These are particularly relevant to an increased risk of COVID-19.
Okay. Well, is it safe for me to get the vaccine if I want to have a baby one day?
Yes, based on current knowledge, experts believe that the COVID vaccine is unlikely to pose a threat or risk to a person who's trying to have a baby in the short or long term.
So, Stephanie explained why people of color have a higher risk of getting COVID, but then it seems like they're also more hesitant to get the vaccine. Why is that?
Well, in a study polling individuals hesitant to take vaccines, Black participants cited systemic racism for their rationale, citing the infamous government-based Tuskegee syphilis study. Another example is the unethical practice that occurred with Henrietta Lacks, where doctors took her cells for study without her consent. Other research related to medical racism experienced by Blacks found that 40% of the measures of the healthcare quality addressed by the U.S. Department of Health and Human Services found that services were worse for Black people over whites.
I know there's a lot of myths and misinformation going around. Is there any truth to that stuff? I know it makes people afraid to get the vaccines, but how do they know what's true and what's not?
I would say mostly a lot. I would say all of those myths aren't true.
I even heard that the vaccine can change your DNA. Is that true?
It is not true. The vaccine will not change your DNA. It will be perfectly safe.
Well, how is this misinformation and these myths getting spread around?
Mostly by social media and like blogs or people just saying it out loud. Mostly some impacts about those misunderstood information is mostly by Facebook, because people are mostly sharing it on there, and that's how it's getting the word out.
Does anybody know how much it costs to get the vaccine? What if I don't have insurance?
So the vaccine is absolutely free for people in the US as per the federal government, but the provider can get your vaccine and they'll bill the insurance company, Medicaid or Medicare, as an in-person administration fee, but overall the vaccine is completely free as per the federal government.
Are there any home remedies that can stop me from getting COVID or cure me if I do get it?
So there are vitamin supplements and teas that really help you boost your immune system, and some of the remedies could even be like hot water with turmeric. That also helps you boost your immune system too.
Once I get that vaccine, can I travel any place I want to?
It really depends on where you're traveling. I would say probably go online and look at like the embassies of where you're going to travel, or like mostly state policies and stuff.
Well, I'm still kind of confused about where I need to go to get the best information and what's not a myth or misinformation. How do I know what a good source is for those things?
It's me, Melissa, your handy librarian from Gwinnett County Public Library System. And I'm just going to go over a few things for what's reliable. We talked about what is unreliable, social media and word of mouth. But if we want to go by the Medical Library Association on finding good health info, when you're evaluating content and looking for good information, you need to ask a couple questions. The first being, who is sponsoring the website? Can you identify who it is? Are they a government agency, an educational institution, or a professional organization? And if it is a commercial site like a .com, what are they selling, and would what they're selling benefit them? Number two, how often is the site updated? We all know how important it is to find very current information. So if you're looking for COVID-19 vaccine information, make sure it's definitely from this year and it's up to date as possible. You don't want to be looking at anything from 2020 or beyond. Number three is, does the site present facts and not opinions? This is information, not what people think. So make sure that it's straightforward and that there are qualified professionals. Four is, who's the intended audience? Because you're members of the public, it should be for a general audience or the public. You can look at professionals. And if you want more info, please come to the library, check out our websites, and we will be sharing a handy information sheet that will help guide you towards some reputable sources and websites.
That's great. Thank you. That's really all the questions I had on my list here today. Thank you guys so much. I really appreciate all the good information that you've shared with me today, and I'm looking forward to looking up some of those resources. Thanks, everybody.